Hi, Dr. Minkoff, Lifeworks Wellness Center. Today I want to address for a few minutes hyperthyroidism. This is often called Graves' disease. What this means is that the thyroid gland is putting out too much thyroid hormone. The feeling people get when there's too much thyroid hormone is like they're on crack or speed, or they had 7 cups of coffee. Jittery, fast heart rate, feeling kind of manic. Often people will lose drastic amounts of weight because the thyroid is burning through calories so fast. Now, thyroid controls metabolism. So if it's too high, then the metabolism is too high and the person can get symptoms. So oftentimes their heart rate will be very high. They may have high blood pressure, and they may feel a little bit crazy because things are going so fast. I saw a person not too long ago. His normal weight was 165. After 5 weeks of undiagnosed hyperthyroidism, his weight had gone down to 115 pounds. He had just basically burned through everything. Okay? Now, normally an endocrinologist, when they see hyperthyroid with the symptoms, will use medication to kind of quell the reaction. These are usually beta blockers and also medications that sort of stop the thyroid from being able to produce more thyroid hormone while we try to figure out what's wrong. Okay? These are called like PTU, propylthiouracil. Drugs like this can actually shut the thyroid off so the person isn't feeling so manic. If the person's in an emergency kind of condition, these drugs can really make somebody feel better and they can really be helpful, and there's nothing wrong with using them. Sometimes high-dose iodine can turn off a thyroid. That's how they used to do it in the old days, but these modern medications seem to work fine, and so I'm not against them. The main thing, though, is to find out, why is this happening? Why is this gland way overproducing? Is it a tumor in the gland? We can often see this with an ultrasound. If there's a tumor putting it out, then that tumor has to be dealt with. Is it a reaction, an autoimmune reaction that's occurring where the body's attacking the thyroid? And because the thyroid is attacked, it's under assault and it is putting out too much hormone. So this may be from leaky gut or from gluten allergy or dairy allergy or something like that. So we can figure that out and stop it. Most endocrinologists in people with Graves' disease give them a dose of radioactive iodine, and this radioactive iodine will go to the thyroid gland, kill it so that it stops producing so much. Unfortunately, radioactive iodine also goes into the breast, so this is a radioactive substance. And iodine collects in ovaries, in breasts, in prostate tissue, as well as in the thyroid. So I don't like this treatment because now you're going to radiate these other perfectly normal organs when they don't need any of this done. We find, and I found this to be 100% so far, of people who have hyperthyroid disease don't need radioactive iodine. The other thing that the surgeon might do is cut out the thyroid so there's no thyroid to actually produce too much hormone, and then you just give the person prescription thyroid to try to keep them even. We in our practice have not had to do this. I haven't had one hyperthyroid patient that we have not been able to control, at first with medication, the beta blocker and the PTU, but usually there are dental factors which are affecting the thyroid. Root canals, deep pockets, cavitations. When we handle these, many times the thyroid settles down. Sometimes it's an autoimmune condition. We can settle it down. We can handle the leaky gut. We can handle the heavy metals. So that most cases, or virtually all cases that I've seen so far of hyperthyroid, within 3 to 6 months, they don't need to take the suppressive medication anymore. Their thyroid goes back to normal levels. They didn't get radioactive iodine. They didn't get their thyroid cut out, and they're doing fine. So if you have Graves' disease or hyperthyroidism and you don't want your thyroid gland removed and you don't want to get radioactive iodine, we probably can help you through diet, nutrition, supplementation, and figuring out why is your body doing this, and then getting it to stop it because it's a result of something abnormal going on. Okay? Hope this helps.